Hello everyone, welcome back to our channel. Today we're diving into a topic that might not seem urgent at first glance, but is absolutely critical for your health. Low oxygen levels in your blood. Imagine this. You wake up feeling unusually tired, your head is pounding, and you can't seem to focus. You chalk it up to stress or lack of sleep. But what if these symptoms are your body's way of telling you something far more serious is happening? Oxygen fuels every cell in your body. And when levels drop, the effects ripple across multiple systems. The signs can be subtle, like headaches or dizziness, or alarming, such as confusion or bluish skin. But here's the kicker. Catching these warning signs early can prevent bigger problems down the line. In this video, we'll explore 12 uncommon yet crucial signs of low oxygen levels, explain why they matter, and provide actionable steps to protect your health. By the end, you'll have a clear roadmap to recognize these red flags and take control of your well-being. Sign number 1, rapid heartbeat, tachycardia. When oxygen levels drop, your heart kicks into overdrive to deliver oxygen-rich blood to vital organs. This condition, known as tachycardia, is one of the body's first responses to oxygen deprivation. You might feel like your heart is racing, even while resting, and experience chest discomfort or anxiety. From my years of practice, I've seen patients with chronic conditions like COPD or heart failure frequently develop tachycardia. But here's what most people don't realize. Untreated rapid heartbeats can lead to arrhythmias or even heart failure. If you notice persistent tachycardia paired with fatigue or shortness of breath, don't ignore it. Early treatment, whether through oxygen therapy or addressing underlying heart or lung issues, can make all the difference. Sign number 2. Excessive sweating. Sweating isn't just about cooling down. It's often a sign of stress on the body. When oxygen levels are low, your body releases adrenaline, triggering excessive sweating. Cold, clammy skin is a common indicator, especially when paired with rapid breathing or a fast heartbeat. This symptom is particularly concerning in conditions like asthma flare-ups or carbon monoxide poisoning. In severe cases, excessive sweating could signal hypoxemic shock, a life-threatening situation where oxygen deprivation harms organ function. If you notice pale or bluish skin alongside sweating, seek medical attention immediately. Addressing the root cause, whether through oxygen therapy or other interventions, is essential. Sign number 3, cyanosis, bluish skin tone. Cyanosis occurs when deoxygenated hemoglobin builds up in the blood, giving the skin, lips, or nails a bluish tint. It's most noticeable on thin-skinned areas like fingertips or lips, but can also appear in mucous membranes for individuals with darker skin tones. Sudden cyanosis might indicate choking, drowning, or a severe asthma attack, while chronic cases are often linked to conditions like COPD or congenital heart defects. The speed and severity of cyanosis provide critical clues. Sudden onset could mean a pulmonary embolism, while gradual changes may point to worsening heart or lung disease. Immediate medical intervention is vital to restore oxygen levels and prevent complications. Sign number 4, confusion. The brain is one of the most oxygen-dependent organs, so when oxygen levels drop, cognitive functions suffer. Confusion, memory loss, and difficulty focusing are common symptoms. Early signs include trouble recalling recent events or finding the right words during conversations. In severe cases, individuals may fail to recognize familiar faces or surroundings. I've treated patients with COPD or sleep apnea who experience confusion due to chronic oxygen deprivation. At high altitudes, climbers often report disorientation as part of altitude sickness. These examples underscore how vital oxygen is for clear thinking. If you or someone you know exhibits these symptoms, seek medical help promptly. Sign number 5, euphoria. Believe it or not, euphoria can be a deceptive sign of low oxygen levels. When the brain doesn't get enough oxygen, it compensates by releasing chemicals like adrenaline, creating a temporary sense of happiness or detachment. While it might feel pleasant, this state masks the seriousness of the situation. Climbers experiencing altitude sickness often report euphoria just before their condition worsens. Don't let this false sense of calm fool you. Ongoing oxygen deprivation can lead to fainting or seizures. Sign number 6. Visual problems. Low oxygen levels can wreak havoc on your vision. The retina and optic nerve rely heavily on oxygen, and shortages can cause blurred vision, spots, or flashes of light. In severe cases, tunnel vision or total vision loss may occur. Conditions like COPD or sleep apnea can lead to ongoing visual disturbances, while sudden episodes might result from carbon monoxide poisoning or high-altitude exposure. Prolonged oxygen deprivation can permanently damage the optic nerve, leading to irreversible vision loss. If you experience visual problems alongside other symptoms, consult a healthcare provider immediately. Sign number 7. Feeling lightheaded. Dizziness or lightheadedness is one of the earliest and most noticeable signs of low oxygen levels in the blood. The brain relies heavily on a steady supply of oxygen to function properly, particularly for maintaining balance and spatial orientation. When oxygen levels drop, the brain struggles to perform these tasks, leading to feelings of unsteadiness or a spinning sensation. This symptom can range from mild dizziness to severe lightheadedness that worsens when standing up quickly or moving around. In extreme cases, it may result in fainting or loss of consciousness, which poses significant risks, especially if the individual is engaged in activities like driving or operating machinery. Chronic dizziness often points to prolonged oxygen deprivation, commonly seen in conditions such as pulmonary hypertension, heart failure, or chronic obstructive pulmonary disease, COPD. On the other hand, sudden episodes of lightheadedness could indicate acute issues like carbon monoxide poisoning, high-altitude exposure, or even a pulmonary embolism. Addressing the root cause, whether through supplemental oxygen, treating underlying lung or heart conditions, or removing exposure to harmful environments, is essential to prevent further complications. Early intervention not only alleviates dizziness, but also protects against more severe consequences like organ damage or accidents caused by fainting. Sign number 8. Persistent fatigue. Fatigue associated with low oxygen levels is far more debilitating than ordinary tiredness. It manifests as an overwhelming, persistent exhaustion that doesn't improve with rest or sleep. Unlike normal fatigue, which resolves after adequate rest, this type of exhaustion stems from the body's inability to produce sufficient energy due to insufficient oxygen reaching cells. As a result, individuals may experience muscle weakness, mental fog, difficulty concentrating, and an overall sense of being physically and mentally drained. Even simple daily tasks, such as walking or talking, can feel exhausting. This form of fatigue is prevalent in chronic conditions like COPD, sleep apnea, and heart failure, where oxygen delivery to tissues is consistently impaired. Sudden onset of extreme fatigue at high altitudes or during respiratory infections should raise immediate concern, as it could signal worsening oxygen deprivation. Restoring oxygen levels through therapies like supplemental oxygen, addressing underlying health issues, or making lifestyle changes can significantly alleviate symptoms and improve quality of life. Ignoring persistent fatigue can lead to long-term complications, including cognitive decline and reduced physical resilience. Sign number 9. Nausea or vomiting. Low oxygen levels can disrupt the digestive system, causing nausea or vomiting. Like all organs, the stomach and intestines require oxygen to function effectively. When oxygen supply diminishes, the digestive process becomes compromised, leading to gastrointestinal distress. Nausea might also occur due to oxygen deprivation in the brainstem, specifically the vomiting center, which regulates nausea responses. Repeated vomiting exacerbates dehydration, reducing the blood's ability to carry oxygen efficiently and creating a vicious cycle. If nausea is accompanied by other symptoms like fatigue, confusion, or breathing difficulties, it's crucial to seek medical attention promptly. These symptoms together could indicate serious underlying issues such as carbon monoxide poisoning, severe asthma attacks, or worsening heart or lung conditions. Treatment typically involves rehydration, restoring oxygen levels, and addressing the root cause of the oxygen shortage. Recognizing and acting on these warning signs early can prevent life-threatening complications. Sign number 10, tingling or numbness. Tingling or numbness in the hands, feet, or other extremities is a key indicator of oxygen shortages that impact both nerve function and blood circulation. This symptom arises when nerves, which rely on oxygen to transmit signals, are deprived of adequate oxygen supply. Fingers and toes are especially susceptible because they are located farthest from the heart, making it harder for oxygen-rich blood to reach them efficiently. Poor circulation exacerbates this issue, as reduced blood flow further limits oxygen delivery. Conditions like carbon monoxide poisoning or high-altitude exposure can also trigger these symptoms by hindering the body's ability to transport oxygen to tissues. Addressing this symptom involves improving oxygen levels through therapies such as supplemental oxygen, maintaining proper posture to enhance blood flow, or treating underlying health conditions that contribute to poor circulation. Sign number 11. Headaches. Headaches caused by low oxygen levels often go unnoticed because they resemble tension or dehydration headaches. However, these headaches occur when the brain lacks sufficient oxygen, prompting blood vessels to widen in an attempt to increase oxygen delivery. This dilation creates pressure changes within the skull, leading to pain that ranges from mild discomfort to severe throbbing. These headaches serve as an early warning sign of hypoxia, a condition where the body or specific regions, like the brain, do not receive enough oxygen. Ignoring this symptom can allow the condition to progress, potentially resulting in more serious complications such as confusion, fainting, or even loss of consciousness. Recognizing and addressing the root cause of these headaches is critical to preventing further health risks. Sign number 12. Rapid breathing. Rapid breathing, known medically as tachypnea, occurs when the body attempts to compensate for low oxygen levels by increasing the breathing rate. In this state, individuals take shallow, quick breaths that fail to facilitate adequate oxygen exchange in the lungs. This inefficient breathing pattern can lead to hyperventilation, where excessive carbon dioxide is expelled, causing lightheadedness, tingling sensations, and additional strain on the respiratory system. Chronic respiratory conditions such as asthma or pulmonary fibrosis, as well as sudden issues like infections or high-altitude exposure, can trigger tachypnea. The exhaustion associated with rapid breathing worsens other symptoms of oxygen deprivation, including fatigue and confusion. Stabilizing oxygen levels through treatments like supplemental oxygen, ventilation support, or managing underlying causes is essential to alleviate this debilitating symptom and restore normal respiratory function. Key takeaways: 1. Recognize early warning signs. Symptoms like rapid heartbeat, excessive sweating, and cyanosis are red flags for low oxygen levels. Act quickly. Seek medical attention if you experience persistent symptoms like confusion, visual problems, or tingling. 3. Address underlying causes. Whether it's COPD, sleep apnea, or altitude sickness, treating the root cause is key to recovery. 4. Prioritize prevention. Regular checkups and monitoring oxygen saturation levels can help catch issues early. 5. Stay informed. Educate yourself and loved ones about these signs to ensure timely intervention. Thank you for watching.